So I couldn't I couldn't go through the boarding gate, and I was told that I'm late. So what I did is I sent a WhatsApp message to a doctor that I was working with, that I had been working with for about a week before I left. So it was around 6 that time, 4, 5, 6 around there, in the afternoon Sunday. So guys, listen to this story. Listen to this, and you'll understand why it's a depressive sort of like story for me, and all of that. And as you're gonna come to internship, I want you to be aware of, you are gonna have your low moments, you are gonna have your depressive moments. Some of them will be because of you, some of them will be because of your fellow interns, some of you will just be because of your seniors. So yeah, but you are gonna meet them, you're gonna get a lot of them. So now when I sent him that message that, hey, I'm gonna try and get, I was like, Doc, I've just missed my flight, I'm gonna make sure that I get the earliest flight possible in the following day. And he doesn't respond, but I didn't pay attention to that because I knew that I sent the WhatsApp, and throughout the week that I was working with him, we were communicating a lot through WhatsApp. So I was like, whenever he sees it, he's gonna actually read it and respond. And then around 9-10, I realized that this guy has not responded, but I could see that he has read my messages. But I was like, okay, maybe he since he has seen it, so he's aware, so I don't have to worry about anything. And then so I tried to get so the earliest flight that I could get was at I think past 8. I can't remember if it was past 8 or not, but I was flying from OR Tambo to East London. I wasn't flying to Mthatha. So it usually takes about 2 hours, a flight from East London to Joburg, or 1 hour 45 sometimes. So now, when I landed at 11:15, I had so many missed calls. I had so many messages, so many voice messages, and I knew that something is happening. Before I could even listen to them, I knew something is happening. So when I saw these, so it was doctors that I was working with, it was interns, it was the consultant, and who was in our firm. Then I was like, okay, let me just try to call the doctor that I sent a message to. So I called this doctor, and then he was like, no, you're not supposed to tell me. I only worked with you for a week, so you were supposed to talk to Dr. So-and-so and not me. But I was like, I didn't want to have a fight with my senior and start asking him, but why didn't you tell me, blah 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 blah. I was like, oh, okay, no, I didn't know. I said, okay. So I drove like a maniac. Guys, I took 2 hours to get to Mthatha from East London. It's not something that is supposed to happen, but I took 2 hours that day. I got there at like 1:15. So, after I called him, I listened to the voice notes, and to the voice notes from the consultant. He was like, I need to come to his office as soon as I come to work. So 1:15, I go to his office, or I call him. He says, okay, no, I'm still busy, just coming in an hour's time. So I go to the ward, I do what is needed, what had to be done in the ward. There was ward work, it was not finished. So I did the word work, and then when it was, so an hour later, I went to his office. When I got to his office, he gives me a letter. He gives me a letter, guys. And I tried to explain what happened, but he was just having none of it. He gave me this letter, and with my name on it, and then he made me sign that he gave me the letter. So I signed. You know, when you want to talk to someone, but they're not, you can see that they don't want to listen to your story. Whatever story that you want to tell them, they just don't want to listen to it. So when I read this letter, it was stated that I had taken leave without organizing it before I actually took the leave. So that is like abandoning work. Actually, at the end, there were words that I abandoned my duties and blah, 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 blah. Now, guys, look at me. I'm a first day intern. And I have never been a doctor before. And I have never, in all the other auditions that I've been before there, I've never had a problem with, first of all, being sick. I've always taken leave when it's my time to take leave. Now, I get this letter. And on top of that, the previous week before the weekend, I had worked in 2 places because I was working for an intern that they didn't come to work because of personal reasons. So I was made to cover 2 places. Not that the consultant knew about that, but the MOs, they knew about that. And you know, when you push yourself, you make sure that you do your work, you make sure that you sometimes go an extra mile for your patients, sometimes you come in early in the morning before people come, or sometimes you even leave late, you don't even take lunch sometimes. And for you now to have a problem on this one day, you get a letter. So that's why I got depressed. And now I was sitting and thinking, what does this letter mean? Does this letter mean that I'm going to have to repeat this block? Does this letter mean that should I do something similar to this, I'm gonna, like, I need to understand what this, and it wasn't stating there, was it a written warning? What was it? So I didn't know. So I got so depressed, and I asked to meet the head of the department. I asked him for a meeting because I just needed to know what this is. And the person that gave me this was not willing to engage, you see. And so guys, like I'm saying, the depressive part is that I know how, I know my work ethic. I know that whatever that needs to be done by me, I will do it. And sometimes I even help other people when it's needed. And when you know that you always try your best to put your patients first, you try to make sure that there's nothing that that is gonna there's nothing that you make sure that there are no complaints when it comes to your work. Your work is just as it is. It's just clean. It's just the way it's supposed to be. And sometimes, like I'm saying, you even go an extra mile sometimes. Now, for one thing that you did, which is not even your fault, you get that kind of a letter. So I was depressed. I felt betrayed. I felt, what are the words? It was starting now to come on, to come on me that, you know, how unfair the world can be, how unfair the work environment can be, how unfair the people that I was senior sometimes can be. And I mean, those kind of things. The thing is, this, guys, I've spoken about mental health and how important it is. The thing is, when you talk about mental health amongst healthcare workers, if you don't know anyone who has committed suicide or who is on antidepressants, I will tell you now, there are so many medical students on antidepressants. There are so many doctors on antidepressants. And it's not really the work. It's not the work that we do. It's the things around the work that we do that is depressing us. It's the things around the work that is causing people to leave medicine. We are going to talk about those things one day. If medicine is so special, if it's so precious, if it's so fulfilling, okay, it is fulfilling and blah, blah, blah. But why are doctors quitting medicine? Ask yourself that question. Why are people who went to school, medical school for 7 years, 6 years, 5 years, why are they quitting medicine? I'm not saying they are quitting clinical practice, because there's a lot of people who are quitting clinical practice, but there's a lot that are quitting clinical medicine. I mean, who are quitting medicine as a whole. They're just like, and it's not because of the patients. It's not because of their incompetence. It's not because of, it's the things around the work that we do, which there's no one who's willing to actually address them. There's no one who's willing to sit and listen and do something about it. That's what is happening. So we lose good doctors day in and day out because of a lot of things. A lot of things. Anyway, but luckily for me, I went to the consultant. The consultant was actually very happy that, okay, guys, that in the firm where I was working, we were 3. The day I did not come, the other 2 did not come as well. They had different problems as well. And it's the same interns that I covered for the previous week. One of them is the same intern that I covered for last week, and also this week is not around. So we all got those letters. And then, so when I went to the head of the department, I was like, you know what, I heard about your story, and I tried to call you guys. I couldn't get you on your phones. And for you to actually come to my office and have this meeting, that says a lot about you, because the other 2 have not even made attempts to come and talk to me about what happened and all of that. So I can assure you that if this is your only offense and nothing is going to happen again, you should be fine in terms of you being signed off. So his words are the ones that actually made me now to think clearly and be like, okay, now I can focus on what I need to do. And so it was like as if he has given me a new life, basically. That's why, because I felt like, okay, because I knew that there was going to be nothing that was going to happen again in the future. So that would actually count as a second offense. So I was like, oh, okay. So I was okay, thank you so much, Prof. It's fine. I'll behave, I'll be a good boy, and all of that. So that was my depressive moment, guys. Depressive moment. But it's over now, it's fine. I got signed off, everything is fine, yeah. So my highest moment in during these 2 years, that was my lowest moment, né? So I'm talking about now my highest moment. My highest moment, there's a couple, but there's this one that will always stay in my mind. When I was in family medicine, I was in casualty where we see medical emergencies. So I saw this old lady who was accompanied by a younger, so it was her daughter that accompanied her. But yeah, she was much older than me still, even though she was younger than the patient. But she was still much older than me. So I saw them because I love internal medicine. So I love investigating. I love checking this and checking that and checking that and checking that. So they came with let me not say their condition. Just for let me just not mention. So I did my best. I did what I could, and it was one of those cases that I'm just comfortable with, and I didn't even go and discuss this patient with the seniors or anything like that, because I just knew what I needed to do, and I just knew what medication I needed to put her on and all that. And I knew what investigations I needed to do. Now, the following day, the head of the department, one of the consultants, not the head, but one of the consultants, she comes to me. She's like, Dr. Nufingane, there's a patient that you saw. You know, when you are walking in the passage, and then I was walking in the passage, and then I met her. She was like, Dr. Nufingane, the patient that you saw, I froze, guys. I mean, she's a consultant, and we've never spoken about any patient with her, because she's not really she's not seeing patients. She's just managing and just seeing that making sure things are run smooth. So she's not very clinical. What I'm trying to say, she's not very clinical. So she's not someone who I discuss patients with. If it was someone that I normally discuss patients with, I was gonna know that, okay, it's a patient that we've probably maybe spoken about before. But for her to come and be like, there's a patient that you saw, and I know that she's one of the managers in the hospital. So I froze. I was like, what did I do? She was like, that patient says you must be given an award. She said a prize. You must be given a prize. And then I could start breathing, guys. She says you must be given a prize. I was like, oh, okay. But for what? She was like, because of how you treated them yesterday, how thorough you were, how professional you were, and blah, 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 blah. And now already, because I started now to think, who could it be? And I asked, do you know their names or something? I wasn't going to know, because even myself, I don't remember my patients' names. And then she was like, actually, the people that you saw, the daughter of that lady that you saw yesterday is the lawyer of the hospital. She's the one that actually defends hospital litigations. Guys, I froze them all. Because now, when she was saying that, I was thinking, what if I had messed up? What if I had been unprofessional? What if I had whatever? Because now I could hear what she was saying, but now my mind was like, what if? So, okay, I was like, oh, okay, no, thank you so much for that, Prof. Thank you so much. Then she was like, okay, now keep it up, blah, 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 blah. And then now, I meet one of the managers, another manager again, the same day. And then he was telling me the same story. Apparently, the minute those patients left the hospital, before they could even get out of the hospital gate, they called the manager, because they've got their numbers, because they work together, they're hospital lawyers. And I didn't know about that. And to me, they didn't even look like they've got money, guys. They didn't even look like they've got money. So he told me the same story. I was like, oh, okay. So it means this thing is very, very true. So when he described now, and then I said like, okay, no, I think now I remember these patients. I think now I remember these patients. Because it was the patient that I had seen the previous day. So I could now, from the description, I could remember the patients. So that was my, okay, that was my highest moment. Let me just tell you about my second highest. Like I said, there's a couple of them. My second highest moment, still in family medicine, it's when I picked up a heart block. I picked up a heart block. This is how I picked up this heart block. I had this patient that was sent from the clinic that she was collapsing and having dizziness and sometimes palpitations. So I was like, when I looked at her at her vital signs, she had a pulse of like 55. So that's a bradycardia. So the next thing I was like, okay, let me get an ECG. I put the lead, connected, and then I saw that what morbid? I thought it's morbid 2. It appeared as if it's morbid 2 because I could actually see that you get the beat and then you drop the beat and all that. And then I was so because it was my first time picking up a heart block and I was in OPD when I picked it up. So I was so excited to bring the bloods and discussing with internal medicine. And then they agreed that she's got a heart block, and then they sent the patient to the cardiologist. When I did a follow-up, they actually made a diagnosis of 3rd degree heart block. And to cut the long story short, for some reasons, the patient wasn't operated in Nelson Mandela at the time. The family wanted her to be operated, so they opted to go to East London, I think to a private cardiologist. That's how she got her pacemaker, because I did a bit, because I met the daughter after. The daughter is also a nurse working in the hospital. So I did a follow-up, and then, yeah, she's got a pacemaker now. So those were my two highest moments. Yes. Oh, okay. Specializing. What am I gonna specialize in? I love internal medicine, but when I sit and think about internal medicine, I love it, guys. I love it. But one thing that is worrying me about internal medicine is the fact that the people that you meet in internal medicine are people that most of them you can't really, most of them you just control symptoms. Many of them, yes, there are those that you're gonna see and make a diagnosis and all that, but majority of them, they're already sick, and then they are in their end stages of their conditions. And that, for me, I would love to make a difference. I would love to do or make interventions when the disease is starting. I would love to modify the disease process, modify the disease progress, delay it, and all of that. So that's my word about internal medicine, such that I've thought about family medicine, but I think the other things of family medicine, like your ethics and your other things, would bore me. And the other things just about family medicine, yeah, there's a lot of, you know how family medicine is. There's just a little bit of internal medicine there when you are studying it, but when you are practicing it, there's a lot of internal medicine. And because of that, I've thought about just being a career MO, not a chronic MO, but a career MO. I've thought about that. And also, I've got life outside of hospital, and I want to maintain that life, and I want to grow there as well. So I'm still thinking about it, but yeah, it's gonna be around those three. Yeah, guys. Lastly, do I think that medical school prepared me well for internship? Yes, definitely. If I were to go back to medical school, what is the one thing that I would do differently or change? One thing that I would do differently is I'll try to enjoy medicine. I'll try to enjoy hospital. I'll try to enjoy studying. I'll try to enjoy um, in medical school we are also focused on we are writing, and we forget to actually study to actually assimilate the information such that it becomes a part of us. That's what we always forget. So I'll try to do that. The more I'll try to just enjoy and not be under pressure that I want to finish and go and work, because that time of working is going to come, and it's going to come when you least expect it, and it's going to come with its challenges. Yeah, that's my internship experience, guys. One thing that I want to also, guys, to make you to be aware of is that the passion of practicing medicine, you go to school, you graduate, you have it, you start internship, you have that, you want to be that doctor, you want to be that good doctor, you want to be that doctor that goes an extra mile for your patients, and blah, 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 blah. But what I want you to be aware of is that what I've learned, what I've realized is that there are two things that can destroy the passion, the excitement that you have. And those are work politics. Work politics. And I mean, it's stupid work politics, like stupid work politics. That's number one. Number two, the bullyism that happens in the workplace. And when I say bullyism, I'm not only talking about seniors bullying you. There are people that will bully you, like your interns. Interns, they have got this ability of they bully. Like interns, they do bully. And so those two things, guys, be careful. Know that they are there. Work politics, they are there. Bullyism is there. Just make sure that you develop a way of coping so that you don't lose the person that you are, so that you don't lose the good doctor that you are, the good doctor that you want to be, so that you don't lose that, because it's going to happen. It gets to a point, I mean, the bullyism, the work politics, they get to a point whereby you become that doctor who says, I'm just doing my work, I'm just going to do my work, as opposed to a doctor who says, I want to see my patient get better, I want to see my patient do well, I want to see them get well. Those are two different things. But when pushes come to shove, you get to a point whereby you're like, okay, let me just do my job. And it's because of the frustrations around the work, not the patients, the frustrations around the work. So it's very important to try, and these things are there, they are there, and they will continue to be there. But what is important is that be aware of them so that you don't lose yourself because of those things. They're just there. Guys, I hope you enjoyed this, and yeah, comment and let me know what you think. And please, if you have not subscribed, please consider subscribing. Thank you so much.